I want to talk about age-related eye conditions and really want to keep it informal enough that we can take questions as we go along here, and certainly towards the end we'll have questions. And I just want to be able to just avail my knowledge of and all my experience over the years in terms of what I've learned to impart that on you. And I hope everybody leaves this presentation today with some useful information. And I want to make sure we do that one way or the other. So just to give you a little bit of background about me, I'm a doctor of optometry, graduated from the University of Houston, and as of last May, been practicing 30 years in the Tampa Bay, Florida area. Prior to that, I was a public school teacher for 5 years in Citrus County, which is north of the Tampa Bay area. And totally enjoyed that, but that teaching stint was really just to get enough funds to finish my schooling. So in terms of college, it was 12 years, so I had to stop in the middle there and raise some funds to continue on. And develop products for the visually impaired, just trying to make life easier for people, trying to increase independence for people that have vision impairments. But anyhow, as far as we age, you start noticing changes. Typically around 40, most people start noticing that first big change in their vision at 40, somewhere between 38 to 42 years of age, called presbyopia. And as we get older, there's an increasing risk of certain age-related eye diseases. And I want to talk about them today mainly. In fact, I want to talk about ones that you can do quite a bit about in terms of preventative measures, things you can either do to delay the onset or even prevent the condition from happening. But I can't really talk any further without really talking about a comprehensive eye exam. And that's really critical because so many eye conditions will be present in the eye, and you won't even know that it's there until it's too late. In fact, things like diabetic eye problems, macular degeneration, by the time you start realizing there's something going on with your vision, it can be very, very far progressed. And the best way to do an eye exam is a dilated eye exam. A dilated eye exam is one where drops are used, pretty painless procedure. It opens the pupil up nice and wide so a person, eye doctor, can look in there. And we're talking about eye doctors, we're talking about ophthalmology and optometry. You know, if we look at the 3 O's, we're talking about optometry, doctors of optometry are licensed to diagnose eye disease, write prescriptions for topical and oral medications. But we're not surgeons typically, and the ophthalmologist is a surgeon. And then the 3rd O we have is the optician, who is a licensed professional that takes our prescriptions in terms of glasses or contact lenses and fills those prescriptions. But the main parts of the eye, not to get too in depth here on the anatomy, I want to look at, first of all, the very first or front part of the eye is the cornea. We're going to be talking about dry eye disease in a few minutes, and it's mainly associated with the cornea here in the front. And then further back into the eye, we have this back area back here called the retina. And the retina is like the film of a camera. I remember we had cameras that had film in them, and that film is like the retina in our eye. So it's where light impinges on the retina, and the image is then transferred back to the brain. But one of the critical and key areas that I want to talk about today in a few minutes is the macula. The macula is the part of the retina that is critical for seeing details like people's faces, recognizing faces, reading, and also for seeing color. So the main conditions I want to talk about today, and if you have questions about others, feel free, we'll be talking about others if you have questions about them. But the main ones I'll talk about today are age-related macular degeneration, sometimes called AMD. There's lots of different kinds of macular degenerations. There's types that you can be born with. There are some that occur earlier in life. And then, but there's the main one that 1 out of 4 people over the age of 70 will experience at some point. That's AMD. Second one, glaucoma. It's a condition where the pressure is too high in the eye, and it can cause damage to the optic nerve and vision loss. Third will be dry eye. And then lastly, I want to talk about low vision. It's more of a condition caused by eye diseases. And you'll notice a real common theme throughout the eye diseases as we talk about them, relating to exercise, not smoking, diet, and lighting. By exercise, I don't necessarily mean getting out the dumbbells and the weights, but just being active, getting out walking. If you can't walk or can't put a lot of weight on your legs due to hip or knee problems or foot problems, getting in the pool, doing some kind of exercise or activity. And not smoking, I don't mean just directly not smoking, but avoiding secondhand smoke when possible. And diet, we'll talk about diet here. And diet is really critical. we find that diet is instrumental in either preventing or enhancing some eye conditions, primarily macular degeneration. We've heard that certain supplements like lutein, we've heard of lutein or zeaxanthin, those are supplements that you can take because actually in the macula, there's actually a layer of lutein, and lutein is protective against blue light, high energy visible light that we'll talk about shortly. But the best foods for eating in terms of eye protection, we can look at foods that are rich in omega-3 and fatty oils like salmon. Salmon's a good one. And I want to be particular about salmon because salmon, you'll see it in the market, but the best salmon is wild caught salmon, not farm raised for many reasons. And then if you look at vegetables relating to eye protection and eye health, the best one is actually watercress. Many times you'll hear kale will be best, but it's actually watercress has the most lutein and best for you. Unless you have a condition where you have blood clotting condition, if you're taking medication as a blood thinner, you want to talk to your primary care doctor first before you start eating a lot of watercress, because watercress actually has quite a bit of vitamin K in it. But the next best food after watercress would be kale. And then after that would be spinach and all the green, collard greens and all the greens, mustard greens and so on. And how much would you want to eat? Well, you want to eat equivalent to about in terms of spinach, maybe about a half a can, 2 to 3 times a week would be really appropriate. Before we go further though, let's talk about lighting also. You're going to hear more and more information about something called HEV. HEV stands for high energy visible light. So if you look at the spectrum across the visible spectrum of light, if you look on this slide here, over to the right, you have the red end of the spectrum. On the left, you have the purple or violet end of the spectrum. You have UV light way over there on the left, and a lot of the UV light is not visible. But there's this band of light called HEV or blue light. It is visible to the human eye, but it has been implicated now in many conditions like macular degeneration, cataracts, and so on. And that kind of light can be blocked out by certain filters in eyeglasses, but we're exposed to it not only naturally by sunlight, because it's everywhere outside in terms of sunlight, but we're then coming inside and we're looking at our smartphones, computer screens, and so on, which put out a substantial amount of HEV light or high energy visible light. So what would make a good light? A good artificial lamp or light would be one that would be flicker free to reduce eye strain, would be glare free or low glare, and one with low blue light output. And you can see a light there. I want to back out of the screen here for a second. Let me see if I can do this. Oops, I hit the wrong button. Sorry, Julie. Let's see here. I want to know how to get to, let's see. Excuse me a second. Alternate F. I don't know how to minimize this. Well, my apologies on that. So I was going to actually show you one of my lamps that I have here, but here's a picture of the lamp. And this is a great lamp. It's a Dr. Lite lamp. Dr. Lite lamps are great because they have a nice ring diffuser, diffuses the light behind are being shown onto whatever you're looking at. It's flicker free and low blue light output. And before I go any further, I do want to talk about, and I forgot to mention that today's presentation is supported by Dr. Lite and also the National Eye Institute, who's helped provide a lot of the materials here. But yeah, let's talk about macular degeneration. As I said, 1 out of 4 over the age of 70 will have macular degeneration, or 1 out of 7 over the age of 50. And it's common in terms of People that have family history of it, if you have a parent with it or had a grandparent with it, oftentimes a few generations back, nobody knew what it was or knew that he had it, but it is very hereditary. And also, it is more common in people with fair skin, light eyes, and affects your central vision. So if you think of your vision in two parts, think of your vision as your central part here and your peripheral vision. Macular degeneration affects your central vision. And that's why it is so difficult for people with advanced macular degeneration to read, see faces. But other risk factors, things you can't do anything about, obviously, is your hereditary or heredity. It's more common in females. You can't do much about that. But things you can do something about, and that is smoking is implicated in macular degeneration. In fact, if you have macular degeneration, much more likely to get much worse and advance much quicker if you smoke. Um, Obesity is a risk factor, and also the amount of pigmentation. Obviously, you can't do much about that, but pigmentation, the lighter you are, the less pigmentation you have in your skin and your eyes, the more likely you are to have macular degeneration. The wrong way here, sorry about that. And this is just a diagram showing what macular degeneration is like for a person. And a person will have their peripheral vision, but peripheral vision is very bad for seeing colors and seeing details. No pain typically with it, very blurry vision. In fact, what most people will say is in early stages, what they notice first is actually straight lines can be distorted, like Venetian blinds or telephone poles will be distorted. What an eye doctor would see looking into an eye with macular degeneration, especially early macular, you see something called drusen. And drusen are just little clumps of waste products that build up in the retina itself. What can be done to treat it? Well, vitamins are very, very important. In fact, Medicare now rates the quality of my eye exams by whether I talk to someone that has macular degeneration about AREDS vitamin supplementation. If I talk to them about it, I get a higher score. If I don't, I get a lower score. And that's true with all ophthalmology and optometry that bill for eye exams through Medicare. Another treatment, not used very much anymore, laser surgery for 20, 30 years ago. It was very common, but not common anymore. Something else called PDT or photodynamic therapy. That was very common about 15 years ago. Today, treatment for wet macular degeneration is eye injections. And of macular degeneration, there's actually two types. There's a dry and a wet. And everybody that gets macular degeneration, it always starts out as dry. And then you have about a 10% chance per year per eye of it turning wet. And wet is the bad kind, but wet is the kind that can be treated with eye injections. And I know it doesn't sound very pleasant to get an eye injection, but in the hands of a good retina specialist, these eye injections should be painless. So what can you do on a daily basis? Well, obviously a healthy diet, as we mentioned earlier. Don't smoke or stop smoking, stay away from secondhand smoke. Blood pressure control is critical. And as we said earlier, healthy weight is important. Exercising and proper lighting and protection. So proper lighting, as we said, low blue light output lights, wearing good sunglasses when you're outdoors in the sun, and light that is flicker free and glare free. Glaucoma is a condition many people have heard about it. You can be born with it. Oftentimes, in fact, most cases of glaucoma, it's causing some severe eye damage, and a person doesn't even know it. Painless typically, and about half the cases, I should say, of all the people who have glaucoma in the United States, half of them don't know they have it. It's undiagnosed, and it's a very slowly progressing condition. In fact, most people will lose half of their vision before they know they've lost any, and then it's a race to save what you have left. More common in African Americans. Everyone over the age of 60 should be checked for it because they're much higher risk for it. And of course, the family history, very, very heredity connected. And this actual scene here doesn't do it justice. This is glaucoma vision loss over on the right. That would be a fairly moderate loss, but it can be a loss where a person is actually literally looking through like a pinhole. It affects their peripheral vision, comes in like tunnel vision, and it just comes down into a small pinhole. It'd be like looking through a keyhole, no keyhole, if you remember what those were like. But a person literally will lose half their vision. I think what people will do though is that they'll actually try to test their own vision. I've heard people come in and they'll say, well, you know, I just check my vision here by wiggling my fingers out to the sides and I see them fine. Well, glaucoma vision loss isn't one that typically you'll lose that ability until it's very far advanced. So very far advanced glaucoma, you'll have difficulty seeing your fingers to the side, but not in earlier moderate uh, levels of it. As I said, no pain, loss of side vision, treatment, typically medications. There's really great medications we have. A lot of times, all that's necessary is a medication of like an eye drop at the end of the day before bed. Laser is sometimes done, and there's some other conventional surgeries for that. Main thing, just a good eye exam every year or sooner if your eye doctor thinks you're at higher risk for it. And typically they do what's called a visual field test. It's a test that actually checks your peripheral vision in a very sensitive way. And proper lighting, and why do I bring up lighting relating to glaucoma? Not that lighting affects the condition or affects the disease or the process, but with glaucoma, a person typically will lose a lot of what's called contrast sensitivity, their ability to see what they want to see. In other words, white print on black paper or vice versa, it's very high contrast, and most people have very little problem seeing that. But if we lose contrast sensitivity, and that's lost in glaucoma, lost in macular degeneration, and other eye diseases, uh, the lower the contrast sensitivity, the greater difficulty you'll have reading things like newsprint and books and that kind of thing, or seeing for that instance or matter. Things in the house, you're much more likely to fall, and fall prevention is something I take very seriously because it oftentimes can, in the elderly population, lead to very, very serious conditions and sometimes death. So lighting is really critical in throughout that process. On dry eye, this is a third condition I want to talk about because it does affect so many people. It's more common in females and more common as we get older. And it's can be caused by the eyes actually not producing enough tears. Sometimes it can be from the tears evaporating too quickly, and it can cause an inflammation of the eye. In fact, that's a vicious cycle. It can cause inflammation in the eye, and that inflammation can then cause further dry eye, and it gets worse over time. It can really occur at any age. More common too in people that are taking diuretics, um, more common in people that excessively use caffeine. Antihistamines will also cause dryness of the eyes. Anything basically that can cause you to be a little dehydrated can cause issues with dry eye. How would you know if you're drinking enough water? Um, and if you're dehydrated and it causes dry eye, well, a really good indicator of how dry your eyes are is how dry your mouth is. When your mouth is dry, your eyes are already too dry. So it's a great way to evaluate how much moisture your eyes have. And people will notice with dry eyes, stinging, burning of the eyes. They'll feel this, they're sandy or they're gritty. Sometimes it'll even be where the eyes are excessively tearing. Now, that sounds opposite, really, if you think about it, of what a dry eye is. It's like, how could you have dry eye if your eyes are tearing and tears are running out of your eye? Well, what happens is the brain actually starts to overcompensate for the dry condition. So it can vacillate between dryness, and the brain senses that, tells the tear glands to produce more tears, and suddenly now you've got this floodgates are open, now you got too much tears, and then the brain will tell the tear glands to stop making, and then the eyes go back to dry. So it's this vacillation between dryness and wetness, but the underlying problem is dry eye. So some of the symptoms that can occur, obviously, is your heavy eyelids, uncomfortable contact lenses. You feel like you got to blink. You got eye fatigue. It can make your eyes feel like you're tired. But there's great treatments for it. Obviously, beyond just making sure you drink enough water, that's critical and the first thing to do. Omega-3, like fish oil supplements are very important. They can be very helpful. Wearing sunglasses or eyeglasses if it's windy outside. But even indoors, there are actually some eyeglasses. There's a company called, and I have no connection financially or otherwise with a company called iEco. There's a company out in California called iEco, and they produce these moisture barriers, these actual glasses that have shields on the sides. And they also produce a moisture barrier that you can wear at night. It's a clear, very, very soft silicone, basically a pair of goggles that you wear. And it's called a moisture barrier because it actually holds moisture in at night when you're sleeping. The other thing you can do too is avoid overhead fans if you can. Overhead fans, especially at night, can dramatically affect dry eye, make it much worse. because most people don't realize that about 70% of the population will actually sleep part of the night with their eyelids partially open. Yeah, 7 out of 10 people will do that. If your eyelids are partially open and you're under a fan, obviously those tears will start to evaporate off your eye, and you can wake up with very, very dry eyes. In fact, sometimes the dry eye can be so bad that the eyelids, the back of the eyelids, are actually stuck to the front of the eye. And if you go to try to open your eye with that situation, it can actually pull a little bit of the front part of the eye, the cornea, off, and it can be very, very painful. Well, end result or moderate results of glaucoma, macular degeneration, and many other eye diseases, the result can be what we call low vision. And I like to talk about low vision. Low vision is a condition where a person has reduced vision to a point where they're having trouble doing something on a daily basis. We used to say low vision was when the vision was worse than 20/60 and or 20/70. So what does 20/60 or 20/70 mean? Well, 20/60 would mean what I, with normal vision, could see 60 feet away. A person with low vision can only see 20 feet away. So if a person has 2100 vision, it'd be what I could see 100 feet away. A person with low vision can only see 20 feet away. And routinely, we tend to consider legal blindness is about 2200. There's actually some variations on that definition. But low vision can be something as simple as even 20/40 vision. I would consider a person with say 20/40, if they were an accountant and they're doing my taxes and they can't see that decimal point, I would consider that low vision, because that even mild loss of vision is interfering with their ability to perform their activities and what they need to do. People with eye diseases obviously are at higher risk. They get people with injuries, stroke. 1 out of 10 people that have had a stroke will lose vision. But there's treatment options. Most people don't realize there's actually vision rehabilitation for vision impairments. Just like if you lose a function of part of your body after surgery or an injury, you have physical therapy. Most people don't realize when you lose vision, there's actually rehab to regain some lost visual function and visual independence. And that's done typically by an occupational therapist that's specially trained in vision rehabilitation. And we have it in our clinic about 10 OTs or occupational therapists that actually go out to the home. Medicare will actually pay. In fact, most major medical insurances will actually pay for an occupational therapist to go to a person's home if the vision rehabilitation is ordered from a physician. So what can you do if you have low vision or a vision impairment? See a specialist in low vision. There are people like myself that specialize in low vision, and what we do is we find out what vision you have and then what we can do to make it better for you. If you're not sure of who's around that does low vision, the American Optometric Association has on their website a doctor find. You can find it, a doctor locally to you, and also low vision devices. And I'm not talking about just the handheld magnifiers, but I'm talking about good lighting. You can have the best magnifier, and without the proper lighting, that magnifier is not going to work very well. Or vice versa, you get the best lighting without the proper magnification, and it's not going to work very well. You really need that combination. One without the other won't work. So it's a combination of proper magnification and proper lighting. Low glare, no flicker, and low blue light output. So those are critical. And the occupational therapist or the low vision doctor can help you with the proper lighting too. And there's other devices too. There's some really amazing electronic devices called eyesight. There's another one called iris vision. And there's telescopic eyeglasses, and high power telescopic eyeglasses that work very well. What else can you do too if you, with eye strain and dry eye and those kind of things? I always like to use what we call the 20-20-20 rule. And the 20-20-20 rule is about every 20 minutes when you're on a computer or you're reading, every 20 minutes, you look at least 20 feet away for 20 seconds. And if you do that, that can help a great deal. And I'm going to give you one other pointer here before we leave and finish up here. There's something called the Harmon distance. And I don't know if you've ever heard of the Harmon distance. That's HARMOND. The Harmon distance is a distance between my knuckles and my elbow. And people will say, well, how far should I hold things away when I'm looking at them? And that is critical because, and I see this all the time with especially the younger children and teens, they'll be looking at their phone and they'll start out here. And then within a few minutes, they've got it up like this, especially when they're in bed or they're sitting on a chair. But that Harmon distance, that distance between your knuckles and your eyes and your elbow, that distance, that's the proper distance for everyone to hold of the materials away. It could be from the computer screen, your smartphone, or books. So if you want to get more information, I'm available. Give me a call at that phone number on the screen is my office phone number, and I love answering questions and talking to people. Or you can email me at that ejh2020@msn.com. I'm available. If we don't answer the phone, leave a message. We'll get back to you. Uh, Other information, great information from the National Eye Institutes. There's some links on their website too for studies that are going on, trial studies in the medical community for new treatments for macular degeneration, glaucoma, and others. And of course, Dr. Lite, go to drliteusa.com. And on that, at that website, if you have questions or you need more information about lighting, go to their Contact Us page and you can get a hold of them in Chicago. They're in Central Time. They are also a great resource for information on lighting.